Hey everyone, I'm back. So I decided to redo episode 2, and the reason for that is because, with the benefit of hindsight, I thought there were a few more things that I could add to it. I also thought rewatching it back that it was a bit monotonous and I didn't really do justice to the content. So I thought I'd redo it a bit and try and cut it a bit shorter because a lot of it was me talking. So hopefully, this redone episode will be a lot better. So what I plan to discuss is how the elective works on the ground, a little bit about Bara Hospital itself, and then the good and the bad parts about the elective. So the footage just now that's finishing is of the drive into Soweto from the northeast, and then the footage just now is of walking into Bara Hospital to walk into the trauma department. Sorry, the quality is really bad. It's because I was using my other phone that I had in South Africa. Bara Hospital is online quoted as the third largest hospital in the world in terms of inpatient beds. On the ground at Bara, it's humongous as a hospital and it's very flat. So you'll find this all wards on one level, connected by this open air sort of walkway that links the whole hospital together. The hospital is based in Soweto, and Soweto stands for Southwestern Townships. And what a township is it's hard to explain, and I'll talk a bit more about it in the apartheid episode. But essentially, they were originally set up as places for migrant workers to live in, especially during the gold rush in Johannesburg. Then during apartheid, they very much became where the apartheid government put black and ethnic minority communities to segregate them from white communities. And when you go to Soweto, it's quite variable, the levels of poverty, and actually there are some very wealthy areas within the township. But it does have some of the poorest parts of Johannesburg. Soweto has an official population of 1.2 million, so it's an absolutely humongous part of Johannesburg. And one can only suspect that the numbers probably far higher because of subletters and also with informal housing that crops up in these kinds of areas. And on the southeastern edge of Soweto lies Bara Hospital, which is the largest government-run hospital in Gauteng province, providing university available healthcare that's essentially free of charge for most of the people who walk in. Now let's talk a bit about how the elective works on the ground. So one of the first things that I would say is really important to really proactively sort out is your HPCSA registration, because pretty much 80% of the students I met out there hadn't got it sorted by the time they arrived, and if you don't get it sorted then you have to go to Pretoria for the day to sort it out. And it's just an absolute pain in the arse because it's probably the most inefficient public body I've ever dealt with in my life. The second main thing to talk about is whether there's a rota or not. So actually you don't get sent a rota. Essentially the students themselves organise a rota, which is a very basic piece of paper in the staff room which you sign up to shifts for. And all this rota really does is decides who's on call, and what being on call means is just covering the trauma pit and resus. And generally the students split up, so if you're not on call you do the ward work, which is like your bloods, ABGs, taking out chest drains, taking out CVC lines, and if you're on call then you're doing the suturing, the chest drains, those kinds of things in resus in the pit. So your timetable is very flexible to what you want to do. The only thing is that obviously they like to have a student for every shift so that there's always a student on cover. And you can choose your shifts whether you want them to be 12 hours or 24 hours. The only benefit of 24 hours really is that the teams themselves stay on for 24 hours. So if you have a good team, it's quite nice to stick with them for the entire shift. Mondays to Thursdays tend not to be too busy, and you can generally get away with one elective student for the day and one for the night. By the time it hits Friday, Saturday, Sunday though, it's normally at least 2. And when it's payday weekend, you can take up to 4 and everyone will have lots to do. The only time to really keep in your mind is 7 a.m. Or 6:30 a.m. on a Thursday, and this is because that's when ward round starts, and this is when one team takes over from the other team, and it's where all of the doctors go to and all of the elective students go to as well. It's where you'll see all of the consultants, and it's a good way really to just work out how busy it is for the day. now let's talk about the real meat of this episode, which is what's good and what's bad about the elective at Bara. So no elective is perfect, and I think having come back now and spoken to lots of my friends, every elective is different to you, and it's really what you want to get out of it. And going to Bara is not necessarily going to be exactly what's for you. Just like for me, doing certain electives wouldn't be what I would want to do. So let's start with the first positive, which is you see and experience a lot of new things while you're out there. And in the first few weeks, it was literally every 30 minutes I was seeing something totally new that I've never seen before. Like before I came to Bara, I'd never seen a stab patient before, and within the first week I saw like tens of stab patients. So that's one small example of new things you see. The second thing to say is there's lots to do. So back in the UK where I trained, it's oftentimes a struggle to really get a lot of practical procedures done because we have so many allied healthcare professionals who do a lot of the practical procedures. And so if you really like to do things like bloods, if you like to practice your cannulas, if you like to practice your suturing, then here is definitely the place to come, because over the course of the 6 weeks, I must have done like countless bloods, like countless ABGs, and lots of them femoral, so you'll get very good at that. And lots and lots of sutures, like I must have sutured over 100 times during the 6 weeks. And you don't just suture like arm lacerations or limb lacerations, you suture like hands and faces as well. And you'll suture even children, like as long as they're over 10 years old, it's dealt with by trauma. So that's something you need to be prepared for when you get here. And then obviously there's the stuff that you get to do here that you never do back at home until much later in your training, such as chest drains, and you can also do CVC lines, or central lines as other places call them. And you can intubate patients if you want. Pretty much if you want to do something and someone's willing to supervise you, then you can do it. And if you're comfortable, obviously, to try and do it. And then the third main thing I say, which is a real positive, is you do feel like a really valued member of the team. You become really good friends with the interns, and you're treated in that sort of level between a student and a doctor. So you're not quite an intern, but you're not quite the same as like the local students there, or if back at home you're like treated like a final year student. So you're in that sort of nice like bit where you have a bit more responsibility and a bit more respect from all the staff around you. And the fourth thing to say is that trauma is a very surgical specialty, and you can very easily, if you wanted to, spend a lot of time in theatre. So I scrubbed in on craniectomies, thoracotomies, and laparotomies as well. And if you would like to see emergency trauma surgery, then obviously it's the best place to come to. So that's sort of all the positives. The main positives that stick out in my mind.
So one of our girls got sexually assaulted trying to security walk with someone to your car. Because like we're the same, like what's that hospital?
Yeah. Let's talk about some of the negatives then about working at Bara. And the first one to really talk about is the flip side of one of the positives, which was you get to do lots. But the flip side of that is that sometimes they'll give you stuff that is outside your comfort zone, or you know that if you did it, it would be a substandard level of care. And that's when you have to be careful, because there's plenty of times when stuff was given to me, really more sort of dumped on you, where you should know that the person just doesn't want to do it, and so they're giving it to you. But it's the most commonest thing I'd say was tricky sutures, and it's hard to, obviously you don't want to say no, but also you know that if you do them, you're not comfortable doing it, and you're not going to get much out of doing something in a shoddy way. So that's one of the things you have to really watch out for. I think the second thing, which combined with the first, is resource limitations. Like obviously we all knew coming out here that there would be resource limitations, but it's always very different on the ground compared to what you would expect. And certain things that you would expect to be there aren't there, and certain things that you would think they would do, they don't do. And it's tricky in a way, because much like similar to the first one, it really frustrates a lot of the elective students, because you know the gold standard from where you come from, and you just know you're not close to that gold standard. And the main thing that bugs people is sterility. Like, you just can't stay 100% sterile. It's very, very hard. Like, sometimes they would just run out of sterile packs, so you would have no way of keeping a sterile field essentially. And unfortunately, you just have to make do, because you have to still do these jobs, but you just don't have all the stuff that you'd be used to. And it frustrates the hell out of people, but in a way it's also a benefit, because it teaches you that adaptability, which I think is so important. And you never learn these unless you're resource limited. The third thing to say is you have to get used to how the different sort of healthcare staff interact with each other. It's not the same as back in the UK. The role of nurses is very different to the role of nurses in the UK, and so it takes some time to get used to that. You don't get as much help as you would from allied healthcare professionals. There aren't that many allied healthcare professionals, and you don't get that much help, and so you have to get very self-sufficient with doing things. The final thing really to say as a sort of negative is the emotional toll that being in a trauma department takes on you. I think, first of all, it can make you very fed up, because you just see so many, a constant stream of victims of violence, that you do just feel very sad and very depressed about the state of humanity, that in the world this kind of thing happens and this many people suffer like this for very, very petty, trivial reasons that instigated it. But it's just a very difficult thing to grasp your head around, that, oh, these people stabbed each other because they got into an argument over who was looking at whose girl a bit funny. And the second thing really is that it can make you quite cynical. But I always found it impressive that the doctors, they hadn't become super cynical, especially the senior ones. They weren't really cynical, and they still treated the patients with the utmost level of respect. And this is in the face of sort of really awful things that even in 6 weeks that I saw. So I saw a guy who'd been castrated. I saw a lot of violence against women. I saw a lot of violence against children. A child as young as 12 had been stabbed for apparently no reason by an adult. And also pretty traumatic deaths as well that you deal with. So I was dealing with a stab victim doing CPR. He vomited, he shat himself, and we're going on the CPR, and eventually he goes for an open thoracotomy, resus, and dies. And I think this kind of trauma is the kind of trauma that will shape your career and shape your outlook on medicine. And it goes into that territory of that dirty word that we as medical students all think about, which is reflection. And I think, in a way, reflection is annoying when you're told to do it, because reflection is something you do all the time anyway. And I think when you come here to these places, experience something totally new, experience healthcare elsewhere, you're not told to reflect, but you do. And I think it's very important to reflect on these things, because it makes you realise how sort of, in a way, sheltered you are in where you live, that you don't experience these kinds of things, but also in a way that these experiences are so important in terms of developing your own sort of outlook on life. And I think that's one of the best things I got out of South Africa, was I learned so much more, and it sounds really cheesy, but I learned so much more about myself, about my aspirations, about my career, my outlook on medicine, the role of medicine, and I think these things are always all very important in terms of developing as a young doctor and as a person. So in a way, the negatives are what make Bara so good, because they, doing chest drains, doing CVC lines, suturing loads of things is great, and it builds a lot of your practical skills. But these soft skills, these personal skills, these difficult experiences that you go through, they're infinitely, I think, in a way, more useful than the aforementioned clinical stuff, because this is the stuff that you won't see back in the UK, and they're the ones that will actually probably have the biggest impact on your career and in terms of how you think as a doctor. Okay, so that's the end of the episode. Tried to make it a bit shorter, cut it by a few minutes, thankfully, but I think it's much more succinct, and it's much more like having now come back from elective, more how I think now compared to when I first did the episode, which was 2 weeks into my placement. So thanks for watching, and hopefully you found something useful about it.